Welcome to part 2 of our videos on physical activity and cardiovascular related disease. In this video, we'll be looking at the effect of physical activity on cardiovascular risk, including the relationship between physical activity and hypertension and dyslipidaemias, and looking into the physiology underpinning this. In part 1, we presented evidence showing that regular physical activity can reduce the risk of a host of cardiovascular related diseases. For example, meta-analysis concludes that regular physical activity reduces ischemic heart disease risk by around 25%. Some studies have found this figure to be even higher at around 42%. But why is physical activity so good at reducing cardiovascular disease? Well, there are many factors which potentially contribute to this. Physical activity has direct effects such as lowering the body's oxygen demand, increasing plasma volume, stroke volume, myocardial oxygen supply, endothelial function, and decreasing coagulability. Physical activity also affects other cardiovascular risk factors, including blood pressure, hypercholesterolemia, and type 2 diabetes status, and we'll be examining these relationships shortly. Before we do, however, it's important to remember that physical activity reduces cardiovascular disease independently on its changes on these parameters. This finding has largely been explained by an underlying mechanism involving a decrease in chronic low-grade inflammation. This theory is complex and has come from data showing that exercise reduces inflammatory cytokines such as interleukin-6 and tissue necrosis factor alpha and other inflammatory markers such as C-reactive peptide. These markers and low-grade inflammation have been proposed as an underlying mechanism for several conditions such as cardiovascular disease and type 2 diabetes, which may explain why physical activity is so good at reducing cardiovascular disease risk. Hypertension has been found to be the second largest cause of preventable death, accountable for approximately 1 in 8 deaths worldwide. Physical inactivity plays a major role in the development of hypertension, with those who are inactive having a 30 to 50% greater risk of hypertension than those who are active. Physical activity, even brisk walking, can also benefit patients with established hypertension and can reduce systolic blood pressure by 2 to 10 millimeters of mercury and diastolic pressure by 2 to 6 millimeters of mercury. This may not sound like a lot, but even a 2 millimeter decrease is associated with a reduction of 10% in the risk of stroke and 7% in the risk of ischemic heart disease. On top of this, moderate intensity resistance training also conveys further benefit. Be aware that in uncontrolled blood pressure of greater than 180 systolic or 100 diastolic, physical activity, in particular heavy resistance training, is contraindicated due to the risk of generating further pressures. Several lipid abnormalities can convey increased risk of cardiovascular disease. These include increased total cholesterol, high LDL cholesterol, high triglycerides, and low HDL cholesterol. Regular physical activity has been shown to partially reverse these abnormalities. In particular, triglycerides, which can be reduced by around 10%, and HDL, which can be increased by 5 to 8%, although higher levels of physical activity than the UK recommended levels are needed to achieve this. Regular physical activity also improves glucose tolerance, insulin sensitivity, and diabetes risk, which are all highly associated with cardiovascular diseases. In those with glucose impairment, regular physical activity results in a 40 to 60% relative risk reduction in the incidence of diabetes. This is explored further in our video, Physical Activity and Metabolic Health. This table demonstrates that many commonly prescribed hypertension medications have only a small relationship with all-cause or cardiovascular mortality. Regular physical activity, on the other hand, confers a much greater relative risk reduction and is superior to pharmacotherapy in the prevention of death and disease. Thanks for watching. For further information, please see the links presented shortly. Please remember, physical activity affects numerous modifiable risk factors for cardiovascular disease. in particular hypertension, dyslipidemia and diabetes risk, and lowers cardiovascular disease risk independently of these factors too.